Good evening, Facebook family. I'm Dr. Stephanie, a board-certified critical care physician who worked with physicians who are struggling in their careers. They are either burnt out, confused about their next step, or just frustrated with the state of medicine. Through my books, webinars, and professional coaching, I help physicians discover alternative careers in medicine so that they can practice medicine on their own terms. However, my first love is critical care medicine. I have been an intensivist for 10 years. I've been attending for 10 years, and my first love is taking care of critically ill patients. So that's why tonight I wanted to talk about something that impacts us all, not just physicians, but the public as well. And I want to talk about women and heart disease. We are all saddened by the news of the sudden death of Carrie Fisher, best known as her role as Princess Leia in the Star Wars series. She died today of heart disease. She suffered a cardiac arrest while on a plane last week. She was 60 years old. The general public often has the mistaken notion that heart disease is a disease of men. However, we physicians know otherwise. And according to the Centers for Disease Control, heart disease is the leading cause of death in women, according to the most recent data from 2013. So I want to spend the next couple of minutes talking about how we as women can decrease our risk of cardiovascular disease. And I like to talk about this in terms of what I call know your numbers. There's several numbers that we all need to know in order to assess our risk of cardiovascular disease. The first number you need to know is your blood pressure. You need to know what your blood pressure is, and you need to discuss with your physician what is your optimal blood pressure. It never ceases to amaze me as a critical care doctor how many people are walking around with dangerously high blood pressures and they have no idea. So the first number you need to know is you need to know your blood pressure. The second number you need to know is your cholesterol level. Be sure to have your cholesterol checked so that you know what your cholesterol level is. And if your cholesterol level is elevated, you need to work with your physician to come up with the treatment plan to lower your cholesterol level. The third number you need to know, and we all should know this number, is our weight and our body mass index. We need to know whether or not we are normal weight, overweight, or obese. And unfortunately, 2/3 of all Americans are either overweight or obese, and this is a huge risk factor for cardiovascular disease. Many of us have made New Year's resolutions to lose weight. Well, I would like to challenge those of us who need to lose weight to not wait till next week. We can get started today. And the fourth number you need to be aware of is your blood sugar. You need to know what your blood glucose level is. You also need to know what your hemoglobin A1C level is so that you can know whether or not you're diabetic or pre-diabetic. And these numbers will help you and your physician determine your cardiovascular risk factors. The other thing that you need to consider, other things that you need to do in order to decrease your risk of cardiovascular disease is you need to eat a healthy diet. Nutrition plays a key role in maintaining heart health. And the other thing we need to do is to exercise. You need to exercise several days each week for at least 30 minutes, and you also need to limit alcohol. So these are just a few things that we can do in order to decrease our risk of cardiovascular death. Thank you for joining me tonight. I'm Dr. Stephanie. If you already haven't done this, please like my Facebook page, Dr. Stephanie ICU. Thank you. See you soon. Bye-bye.